You said that we all probably have some cancer growing in us. We just don't really know it. Our immune system is probably suppressing it. So kind of expand on that, because I think that's a new concept. In Western medicine, you either have a disease or you don't. It's kind of black or white, but you're talking about this gray area here. Kind of share what you were saying.
So cancer is normally your cells live a certain period of time, depending on what type of cell it is, and it will reproduce another cell, and then it dies. So the mother cell then goes through this process, what's called normal programmed cell death. That's called apoptosis. Actually, the cell kind of shrinks up and shrivels up. This process takes place. It's actually complex inside the cell, in the cytoplasm of the cell. Turns on this cell death program. The cell shrivels up, and your immune cells actually gobble it up and really reuse a lot of part of the cells. So it's kind of a recycling process that goes on in your body, that apoptosis. It's normal. You could say normal aging of a cell, and the cell goes through a normal death process. So cancer is when that process is broken.
Hey everyone, it's Mike Meltzer here with HighIntensityHealth.com. Thanks so much for tuning in. Today we're live with Dr. Kevin Connors, and we're going to talk about the immune system, cancer, and autoimmunity. And Dr. Kevin Connors lectures all throughout the United States and probably the world, I don't know that for sure, about these topics, and has a prolific clinical practice in the Twin Cities, Minneapolis area. So Dr. Connors, thanks for being here.
Hey, thanks, Mike. I appreciate it.
My pleasure. So we met, I think it was back in 2010 or 2011 at an A4M conference. It was all about cancer. Kind of share with our listeners about your clinical practice and, what sort of conditions are you seeing and treating in your day-to-day life?
Sure. We mainly focus on cancer, chronic Lyme, and some autoimmune disease. Typically, the autoimmune patients that we do see are patients that have been multiple other places and find my books online or read some of my work or have heard me lecture, and they seek out care at our office. So though we're in the Twin Cities, quite honestly, probably 70% of our patients come from outstate or out of the country. We have people from Brazil and New Zealand and England and Bulgaria and other countries that I didn't know existed before we heard from them. So it's a great practice. We tend to be, especially for cancer patients, a clinic where, and I think a lot of alternative clinics are this way, that people seek us out when they're in stage 4 and have been given a timeline, like 2 weeks to 3 months or 6 months. Go home and get your affairs in order. Unfortunately, I don't know if that's going to change very soon. Most people are in a lot of fear when they hear of a scary diagnosis that they've been given, and they get kind of rushed into a treatment protocol that they think is maybe their only option. Mm-hmm. And if that doesn't work, which often it doesn't, people are then tend to be open to look at other avenues.
Wow. Gosh, that's got to be very frightening. I had a mini scare here with some chest pain and lung issues, and turned into a CT scan that looked like it was positive and all this sort of stuff, and it turned out to be pneumonia that was asymptomatic. So I can kind of resonate, at least in part, a little bit with some of that fear that people would, overcome their life, with a diagnosis and a prognosis like that. So where do you start with some of these folks? I mean, maybe let's start at the very end, where someone has been told they only have a few weeks to live. I mean, it seems like, in your blog, you say you integrative cancer specialist who doesn't treat cancer. So you're treating the whole body. Like, talk to us about kind of like what's the most important priority when someone comes in with one of these prognoses?
Well, if a person comes in with cancer, we have 4 main points that we want to uncover. And they're similar with any disease, just a little bit different with some other disorders. But number 1, we want to find out what the cause is and get rid of that. And that is something that is not being addressed, at least that I can find out anywhere. If you look on the World Health Organization or the CDC website, you'll see that there are specific known causes for many different cancers. Unfortunately, those are always found post-mortem. So you look at CDC website or the World Health Organization will say that the number one cause of stomach cancer worldwide is Helicobacter pylori infection. However, that was always found post-mortem. After the patient died, it was investigated. Oh, the cause of the cancer was H. pylori. It doesn't still even cross the mind of an oncologist that there would be any reason to find out what the cause of the cancer is. And the reason that is because they don't know how to treat that anyhow. Their purpose in taking on a patient is, what does it say in the Merck manual? What is our protocol for colorectal cancer? What's our protocol for BRCA2 positive breast cancer? What's our protocol for glioblastoma? And then they follow that protocol, typically written by someone in the pharmaceutical industry. But that's the protocol that is the standard medical protocol that they follow. If you'd ask a standard oncologist, well, what's the cause of my cancer? They would probably look cross-eyed at you and say, what difference does that make? We use this and this chemotherapy, then this radiation, and then this surgery, or whatever order that they're going to give it to you in. It doesn't cross their mind. So when you talk about a cause of cancer, you talk about what initially disrupted what was supposed to happen was apoptosis, normal cell death, didn't occur in a cell. And then what is happening is that the normal replication cycle is sped up. So there's something within that cell that's causing this apoptosis to not occur and then rapid replication to be in occurrence. That's what cancer is. Mm-hmm. So it could be a virus, it could be a bacteria, it could be a toxicity, it could be a number of different things. And in our practice, we look for that and find that. And that's our first step. What is the cause and how are we going to get rid of the cause? Now, unfortunately, just getting rid of the cause doesn't help the patient per se with the cancer that is going on right now, because it is that the original cause has caused a cell not to die and is now in a rapid replication phase. Now it's replicating cells with the same DNA that are rapidly replicating. So we have to stop that cancer growth. That's step number 2. So, but finding the cause and extinguishing the cause helps with decreasing metastasis, which is so common and which is really the most deadly thing of all cancers, is when it metastasizes to other organs. Mm-hmm. That's what kills the patient. So the second step then is to find out from a nutraceutical standpoint, because in our practice we don't use standard chemotherapy. From a nutraceutical standpoint, what is going to be the best thing for that patient's cancer specifically? And we test that out. We have a method of testing that out so that we're not guessing. Should we use SEACT or should we use Protocell or should we use, there's a lot of different good cancer killers out on the market, and it gets very confusing for a patient that's even seeking out alternative care, because maybe Aunt Mary got healed by Laetrile 15 years ago and she's still alive, so I should use Laetrile. Well, that doesn't mean Laetrile is going to work for you. Mm-hmm. Or I have a friend at church who his dad got helped with poly-MVA. So he told me all about poly-MVA. So I went and bought poly-MVA and started using it. It doesn't mean that poly-MVA is going to work for me. So that's the thing, is there's a lot of good nutraceuticals out there that are what I call cancer killers, and they work very well, but they don't work very well for everybody. Mm-hmm. There is not any one product that's going to work for every single person, and that's where it gets complicated. So step number 2 is find out through testing what's going to be the best for that person, and it's usually just one of those things. And then step number 3 with cancer is we use the Rife machine with everybody. So we use frequency healing with everybody. So that's a whole process, which is at least an hour-long show in itself to describe how you come up with those frequencies. But we take a couple days for that person in our office to help us find out exactly what frequencies are going to be best for that individual, their condition, to help their liver, help their gut, help their detox pathways, and to help directly kill the cancer with the right frequencies. And then step number 4 is there's just a multitude of other things. Are we going to do juicing? What are we going to be juicing? What is the diet going to consist of? What is this person's metabolic type? Can they be eating meat? Should they be eating meat? So we get very specific into dietary protocols. Are we going to do coffee enemas? Are we going to do some other detox? Do they need liver detox pathway supported? It just gets kind of endless in that category number 4, but we've got to look at that patient as a whole person.
Sure.
So I know I said a lot, but
no, that's great. I'll try to keep that in my head in terms of how you said it, and maybe we can go back piece by piece in step 1 and talk about key biomarkers, that maybe you look at, or assessments or tests, because obviously it would be in an ideal world we could prevent cancer from happening before it does. So what sort of kind of tests lead you to discover what the origin of the cause is? You mentioned heavy metals. We could talk about immune stressors. We could talk about, neurologic, poor thoughts and so forth, how that affects the immune system. Like, where do you start there with assessment?
Well, when we have a cancer patient come in, they always know they have cancer. So typically when we're treating a person with cancer, they already have a previous diagnosis. So, and from a legality standpoint, you cannot legally diagnose cancer without a biopsy. So even if with your chest condition that you had recently, if they thought, that could be possible lung cancer, that still is not legal for them to tell you that unless they did a biopsy of that mass. They could tell you there's a mass there. So same thing for our practice. If a patient comes in with already a diagnosed cancer, your question is, how do we arrive at what the cause is, right?
Yes.
So in our practice, I use a very specialized form of kinesiology to be able to do that. So, but I love functional medicine testing too. So I have another doctor that works with me too that handles all the autoimmune patients and chronically ill patients that aren't cancer patients. And she relies a lot on the testing. So some of the biomarkers, as far as from a testing procedure that a person could do, is you do want to test for toxicities. So there's a number of labs that will enable you to test for different common toxic levels of different pesticides, chemicals that can cause be endocrine disruptors and disrupt apoptosis receptors. You want to test for some simple things like vitamin D levels, because if a person has clinically low, and we're talking about from a functional clinically low vitamin D levels, that's going to set them up for an increased possibility for cancer, because vitamin D is an apoptosis receptor stimulator. That's how vitamin D can be beneficial for cancer. So you do not want to have clinically low vitamin D levels, which, by the way, is very common if you have an undiagnosed autoimmune disease. So it's very common to have clinically low vitamin D levels. And then you want to look at the patient's liver detox pathways, because you could say, and you've probably said this, people have said you are what you eat, but really you are what you absorb, because it's more than just what you eat, because you breathe in poisons and you put poisons on your skin like sunscreen that you absorb. But even more accurate, you really are what you don't detoxify. Mm-hmm. So if you're not getting rid of poisons that you're exposed to, or you could say if you're toxifying yourself faster than you're able to detoxify, well, those poisons have to go somewhere, and they're going to be stored in the cells. They won't stay circulated in your blood or you'll die. So they'll be stored in your cells, and they can be disruptors of apoptotic processes. And be leading a person to cancer as well.
Mm-hmm. Now, would standard liver function tests be good enough, or are you looking at more like, I think there's like the coffee-induced phase 2 enzymes. They'll look at all the cytochrome P450 enzymes. Like, how do you test that?
Yep. So you want to look at the detoxification enzyme pathways. So the standard, so if a person says, oh, I had my liver tested, I went to the doctor and he did a full liver workup. Typically, they're looking at an AST, ALT, and an alkaline phos test, 3 tests that will only be off if the person has a pathology in the liver. So we're not talking about a pathology in the liver, a disease process taking place in the liver at this point, which would show positive if you already had cancer metastasized to the liver. But we don't want to wait till you have cancer metastasized to the liver. We want to know, how are the person's P450 pathways? How are their methylation pathways? And run tests for those. There's, without naming some names of labs, there's some good labs that run panels on just the liver detoxification byproducts, so you can measure those and you can kind of see where there are backups in the detoxification process. And all of the detoxification processes are dependent upon certain nutrients. So then from a functional medicine type practice, you can supplement with good whole food nutrients that will help push those pathways and help a person go through detox. And it doesn't mean that's going to prevent cancer, but it's certainly going to prevent, or decrease your ability or your level of toxicity, which is always going to be beneficial.
Mm-hmm. I love that saying, you are what you don't detoxify. That's pretty fantastic. So one thing we talk a lot about on the show, Dr. Connors, is the weight loss. And we know that individuals that have increased fat, whether it's on the belly or what have you, have a higher prevalence of cancer. And we know that there's this link between hypoxia and the formation of, kind of a dysmetabolism that creates this Warburg effect and promotes cancer growth. So do you want to talk about why people should get their blood sugar in check and lose that belly fat?
Well, two can be separate points there. So dysglycemia in itself is a precursor to, you could say, just about every disease. So when you have an imbalance in your blood sugar, you're going to have issues down the road. You're going to have damage. You're damaging your kidneys. You're damaging your vessel walls. Even if your fasting blood glucose isn't over 125, you're still doing much damage even in the 100 to 115 range. So that being said, that it can lead to obesity as well. But obesity with increased belly fat is really, in my book, a symptom of a disorder. So that isn't the disorder in itself. That isn't the disease in itself. That is a symptom. So you will gain, there's multiple reasons, and you talk a lot about it in your book as well, reasons why a person gains weight. Of course, it has to do with their diet and lack of exercise, the 2 most common things, right? But a person will also hold body fat and body water if they're toxic. So if they're not detoxifying and they're exposing themselves to a lot of toxins via our food supply, number one, and the chemicals in our environment, their body will hold fat, because fat, I always say that fat cells have the spiritual gift of accommodation. They just invite everybody in. They like a lot of neighbors coming over, and they store things. So the purpose of a fat cell really is to store energy. That's what fat is little teeny blocks of very concentrated energy. So that when we go through a famine in the winter, we have all that stored energy to rely on. Well, the problem is fat cells store all sorts of things. And remember, I said if your toxicity level in your blood is higher than your ability to detox at any given time, you will die. So your body will not let you die. It'll push these toxins to your cells. And the cells that take those toxins in are your fat cells. So the more body fat that you have, the more toxins that you really have. And you do have to be careful at the speed at which you lose weight. not going through some fad diet where you're going to lose 20 pounds in a week, because you will be liberating toxins from those fat cells that break down.
Mm-hmm.
So yeah, it's all tied together. That's just another picture of ill health, really.
Mm-hmm. Yeah, I love that, how you broke that down. And, when I first heard that term, this was maybe back in 2007, that fat cells store toxins, I kind of thought that was a little bit woo-woo, a little bit out there, but there's a lot of hard data that show that, like you said, our fat tissue is like a buffer. And there's some really good new research showing that, the amount of fat you have directly correlates to your body burden of endocrine disrupting chemicals and various toxins and flame retardants and so forth. So this is real hard science, but let's kind of go back to the fat cell a little bit. We know fat, is getting kind of we know that it's not just inert. Fat cells release adipocytokines like leptin, and leptin monkeys with the immune system and drives inflammatory processes and is linked with more invasive metastatic cancer. So are you looking at leptin, and can you give us your backstory and perspective on leptin?
So I don't look at leptin particularly specifically for cancer. So my associate doctor looks at leptin as far as weight loss, because it's so important, because it drives appetite, etc. But with cancer, we are more specific to what the cause is. And typically, leptin and disruptions in other hormones are going to be secondary to the cause. So, for instance, let's say we test out a person with my form of testing, and we come up with the cause of their cancer to be a chemical toxicity, like a heavy metal toxicity or something like that. So then our process is, how are we going to get rid of that heavy metal toxicity? Not that in itself is going to change that person's current state as far as cancer goes, but it can help with further metastasis. Now, knowing that, looking at the big picture, though we typically never get into a huge explanation with the patient about this, that's helping the person in so many other areas, not just with cancer. Because you don't have one problem going on and it just leads this person down one singular road that gives them a diagnosis. Remember, any diagnosis is simply a Latin term for the collection of symptoms that person has. And they can have multiple diagnoses, meaning they got multiple dysfunctions taking place. And the person's diagnosis is the thing that's causing the gravest ill to them right now. That's typically what they're labeled with. So personally, I don't look at leptin. That's something that you would look at more with a weight loss perspective, because it ties so much with the endocrine system and their ability to lose weight, and that imbalance is so important. And I know it ties with cancer, but that's not one of the biomarkers we look at. There's just too many possibilities.
Sure. Yeah, that's really well said. So maybe let's go back, Dr. Connors, and kind of talk about you mentioned apoptosis and then metastasis. We know that one thing that our body has natural protective mechanisms, tumor suppressor proteins, and so forth. What sort of natural prevention tips could you offer, in different maybe phytonutrients or dietary compounds or stress reduction techniques that may ramp up our ability to kind of put the flames out before they become full blown metastatic and aberrant apoptosis pathways?
Well, that's a good question. So there are some things that you can do, like, my dad died of prostate cancer and my aunt had breast cancer, and I think there's cancer in the family. Are the things that I should do? Well, some of the things that we touched on, really look at your toxicity levels. So change your diet is the biggest thing. So, and we'll talk about things like curcumin that are so beneficial in upregulating different tumor suppressive pathways. In the tumor suppressor genes that upregulates. There's other nutrients like the medicinal mushrooms that upregulate the different tumor suppressor genes as well. But the bottom line is, it really stems from diet. So if the person, and because that's our number one way that we toxify ourselves. Now, obviously, I've had patients that work in a chemical factory or that are mechanics and for years cleaned parts in a parts cleaning solution without the use of gloves. So the levels of toxicity that they were exposed to was great. Now, I practice in Minnesota, so the amount of farmers that are exposed to fertilizers and chemicals that they're actually handling and mixing and pouring into the bins and going and spraying it out in the fields is just horrific. So there's all sorts of ways that you're poisoning ourselves in our society. But diet is a big one. And when you start looking at, you cannot be eating genetically modified foods. You need to be eating organic. And I remember talking about things like this years ago, before genetically modified foods existed. And it's like, oh my gosh, I mean, people just didn't know anything. Now we live in an age where, there's so much of this information out there. So at least they're not looking at you cross-eyed when you're trying to explain this. But still, I have patients that come to me with stage 4 cancer, and they're eating McDonald's every day. So it's I just don't get it. I think part of it is people want to stick their head in the sand and pretend that it doesn't exist, and part of it is just habit patterns and the excitotoxins that go along with junk food that stimulate the brain and give them cravings for that food again. So it is a literal addiction. But so number one, look at what you're eating. Look at your toxic exposure. Try to limit that. I never recommend that a person becomes a guru per se, but really start to be conscious about what you're doing in life and how you're living life. We could talk about stress issues and such like that too. But from a nutritional standpoint, what should I take from a nutritional standpoint? There's some specific ones that you want to help push your liver detox pathways that you could probably say that almost everybody is deficient in, and that is your good B vitamins and a good methyl tetrahydrofolate product as well, because most of the things that you're eating that is processed and fortified, it's fortified with synthetic supplements that are actually disrupting those pathways and actually hurting you.
Yeah.
And then things like medicinal mushrooms and curcumin and green tea extract and other things like that can be so beneficial that are easy to add to your diet and your protocol as well.
Sure. Yeah, no, Donnie Yance has talked about resveratrol and how that can upregulate, I think, what is it, P53, tumor suppressor. So on the mushrooms, the beta-glucans and so forth, do you recommend, just as a prevention that we should kind of be...
Yeah, mushrooms are a great prevention. Mushrooms are a great immune booster as well. So you do have to be careful of mushrooms if you have an autoimmune disease, because if you have a Th1 dominant autoimmune disorder already, mushrooms can upregulate that and cause more problems. Not all the mushrooms, but some of the mushrooms. Resveratrol is typically a Th2 stimulant. And that's typically fine with most people with an autoimmune disease, because most people with an autoimmune disease are Th1 dominant. The only problem with resveratrol, it has such an unbelievably short half-life in your body. So you really need to take that throughout the day. So if you're going to take it as a capsule, you want to take a lower dose capsule and take them, multiple times through the day. We typically recommend a liquid resveratrol and have the patient put it in a drink water bottle that they're going to sip on all day long, because the half-life of resveratrol, you take 50 milligrams at 9 o'clock in the morning, it's literally going to be out of your body by 10 o'clock in the morning. So you just have no benefit for it the rest of the day. Great different things to add. There's so much research on this stuff now that it's just mind-boggling. So it's really beneficial for people like us.
Yeah, no, that's great. Now let's talk about telomeres and kind of maybe there's some mixed data there, because we know that the enzyme telomerase, and I'll let you kind of tell the story, but a lot of people are trying to prevent aging and they're taking astragalus and this TA65 product. And I guess, kind of I'm a little weary of that, because we know that telomerase telomerase becomes more active in the context of cancer. So is that good or bad in your opinion as someone who treats cancer?
It depends on what you're trying to do. So one of the things that I would be against in the anti-aging movement, and here I have multiple degrees from American Academy of Anti-Aging Medicine, but one of the things that I'd be against with what they're pushing is any growth hormone stimulation as far as if you have cancer. Now, so if you have even if the problem with a growth hormone stimulator is that, and we're talking about using it in a bioidentical format, because that's very common in the circles that I travel in, using a bioidentical growth hormone to decrease the aging, slow the aging process, and it does work. You can't be in any professional sports and do that. You'll be kicked out. You see what it did to Sammy Sosa, right?
Right.
But the danger is if you have even any start of any cancer cells, it is like throwing gasoline on a fire. So I'd highly not recommend that for anyone, even if you don't have any family history of cancer and don't have any diagnosis of cancer. I still think that everybody's got cancer cells growing inside them, so you just don't want to do that. Using a natural product for that, like deer antler, I would say that's okay and that's safe to use as long as you know that you don't have cancer. If you have cancer, you can't do that. Can you use resveratrol if you have cancer? The answer is yes. You can use resveratrol if you have cancer. But even things like kale. So kale doesn't stimulate the telomeres, but it does stimulate. It's very popular in the anti-aging movement because it increases nitric oxide production. So, well, nitric oxide is fantastic. I mean, there's just a ton of information on nitric oxide. Don't we want everybody to have increased nitric oxide? The answer is yes and no. If you have cancer, the answer is no, because nitric oxide, what it does and what it makes it so beneficial for you that doesn't have cancer is that it increases what is called VEGF production. That's vascular endothelial factor that increases stimulation of blood vessels, growing new blood vessels. Well, that is perfect. That is so healthful. It increases oxygenation to tissues. It increases oxygenation to your heart. If you have heart damage, you want nitric oxide. It'll open up the vessels. It'll increase blood vessel growth into the heart. But if you have cancer, it does that exact same thing to cancer. It'll cause your cancer to grow like crazy. So some even food things that you don't want a cancer patient to take would be kale, because kale is such a huge spike for nitric oxide production. So kind of a big answer there, but...
No, that's great. Great information. And I like how you're breaking this down and saying that, one thing is not good for every single person, and I want to kind of expand upon what you said. And I was thinking about asking this, but I didn't want to sound silly on this, but you said that we all probably have some cancer growing in us. We just don't really know it. Our immune system is probably suppressing it. So kind of expand on that, because I think that's a new concept. In Western medicine, you either have a disease or you don't, it's kind of black or white, but you're talking about this gray area here. Kind of share what you were saying.
Well, if a person really understands what cancer is, then it's really easy to understand this. So cancer is normally your cells live a certain period of time, depending on what type of cell it is, and it will reproduce another cell, and then it dies. So the mother cell then goes through this process, what's called normal programmed cell death. That's called apoptosis. Actually, the cell kind of shrinks up and shrivels up. This process takes place. It's actually complex inside the cell, in the cytoplasm of the cell. Turns on this cell death program. The cell shrivels up, and your immune cells actually gobble it up and really reuse a lot of part of the cells. So it's kind of a recycling process that goes on in your body, that apoptosis. It's normal. You could say normal aging of a cell, and the cell goes through a normal death process. So cancer is when that process is broken. So Well, you think, well, that's good. It didn't die. It's living a long life. No, that's not good. It's got to go through the normal process of cell death. And in doing so, then it's recycled and used again. And now you don't have too many cells in your body. So when a cell does not go through apoptosis, now we could have a problem. It doesn't mean it's cancer yet. But it is the first step of cancer. So in order for somebody to have cancer, so if you have breast cancer, you had one cell that did just that. It did not go through normal apoptosis. It stayed alive when it was supposed to die. But then something else had to go wrong in that same cell in order for you to have cancer. So something else that went wrong is that instead of that cell replicating every 12 weeks, like it was supposed to, and then the mother cell was supposed to die, now that replication cycle has been tweaked and changed, and that program is now it's replicating 12 times a day. That would be a fairly aggressive cancer. So instead of that cell living a period of time, replicating itself, the mother cell going through apoptosis, and this process happening again and again, what cancer is that mother cell never died and now went into a rapid state of replication. That's what cancer is. So does that happen in our body? The answer is absolutely. So it happens in everybody. You have it going on inside of you right now, I'll guarantee it. But here's the caveat. So why doesn't everybody get cancer? Well, unfortunately, in the United States, 1 out of 2 people are going to get cancer now within their lifetime. But let's go back 40 years and only 1 out of 50 people got cancer. Why didn't everybody get cancer? Did this happen in everybody at that time? Yeah, maybe not as common, but probably everybody had this go on at least once a year where the cell didn't die. Now it's in a state of rapid replication, but it's replicating once a day now instead of once every 6 months or once every 12 weeks. It's replicating once a day. Now this little mass of now 6 cells large is easily recognized by your immune system as, what in the world is that? That's not normal. And what does your immune system do? So your immune system does one thing, and it does it quite well. If you're healthy, it kills things. So it recognizes things that are not supposed to be in the system. Those are enemies, bacteria or a virus or some sort of pathogen. And when it sees an aberrant cell structure like that, surround it and destroy it. So your macrophages will surround that cancer and destroy it, and you never get cancer because it killed that cell. So does everybody have cancer? Technically, yes. Does it mean that it needs a diagnosis of cancer? No. So a person who's only going to get a diagnosis of cancer is that's grown faster than your immune system can destroy it, number one. Or you had a suppressed immune system because you're under a whole bunch of stress, so your immune system wasn't even capable of destroying that. Or there's multiple other reasons that your immune system isn't able to kill that thing. And now it's to the point where it's too large for your macrophages and white blood cells to destroy it. It's just not killable by your immune system itself. You need some direct help.
Mm-hmm. Gosh, that's beautifully said. I think we need to somehow make the immune system more sexy. Right now, hormones are hot, like you mentioned, growth hormone and anti-aging. But if we really want to increase our longevity, you mentioned 1 in 2 Americans now have the diagnosis of cancer. If we want to live a long, happy, healthy life, we want to prevent cancer. And the way we do that is through immune system. Well, one of the ways, there's many ways, right? But making our immune system more vigilant so that it recognizes these potential aberrant cells. Is that what we're saying?
Yeah, absolutely. So you need a healthy immune system. And that's really the catch-22 of standard oncology. So, you got a diagnosis of cancer, you're in this fear state. So what does fear do to you? It's a sympathetic nervous system response. And your immune system is controlled by your parasympathetic nervous system. So that is shut down. So instantly you have this huge suppression of your immune system just by hearing the C word, in the doctor's office. And then he says, well, we need to do chemotherapy and radiation and surgery or whatever their concoction is. And all of those, what do they do to the immune system? They literally destroy the immune system with chemotherapy. And that's why you have to have your white blood cells tested before each chemotherapy event, because, if it's too low, we could kill the person. So it's a huge catch-22 with chemotherapy. I mean, it's a really bad catch-22 for multiple reasons. So,
wow. Great information. And I was going to ask you this at the end, but let's talk about it now. It's a nice transition. You have a lot of ebooks and information online about this, like we're talking about here, to help people boost their immune system and give them other options and additional resources. So you want to plug some websites and resources where people can learn more about this?
Well, we just launched our new website at the beginning of this year that has all our books on it and such. So that is certainly available. And we realize that, our practice, we see it as a ministry. There's no way that we can help everybody that needs help. So since I wrote my cancer book, I think we've had maybe 30,000 downloads of that book. So a lot of book downloads, and they're all available for free. And actually, in the last year, we changed the book downloads. Instead of just getting this PDF book that you're going to maybe plow through or probably not, I changed it into sections where you get it in your email over the course of about 12 to 15 weeks, and it comes with a short little video kind of explaining that section. Also on our website, I blog every day, just about every day. You got plenty of information there. Probably information overload for a lot of people, but when you're really seeking and you're really hurting, you need that information, it has to be available. So our cancer book is on there. My immune book on autoimmune diseases is on there. That's complete as a free download as well. And my Lyme book is on there because I'm very passionate about Lyme, having it a couple times myself. And my brain book will soon be on there. So that's going to be on there. Wrote that along with my associate, with my partner, Dr. Halderman. So very valuable for people with dementia and ADD, ADHD issues as well. So all that's available on our website, Conners Clinic, CONNERS clinic.com. Everything's free. And for patients, we have a forum that they can go on and ask questions and stuff. So it's a really great interconnection. It's kind of unique to our practice as well.
Mm-hmm. Fantastic. Awesome. And I'll put that in this video for those of you that are driving, or if you're at the gym right now, at highintensityhealth.com/drconners, and links to his website as well. So great, Dr. Conners, awesome information. And before we ask the final two questions, is there anything about cancer or the immune system or maybe Lyme disease that you want to share with our listeners that we didn't get to talk about?
Well, I think if I could give one piece of advice about cancer to people, is that you cannot make decisions based in fear. So you always have more time than you're told. Never feel roped in to make a decision, especially when you're sitting in a doctor's office. Go home, think about it, pray about it, ask questions. There's wisdom in a multitude of counselors. Get advice, and get advice from as many different sources as you possibly can. And then look at the biasness of the advice too. That's very important. And try to weigh it all out. I'm not saying that a person should not do chemo or radiation or surgery. Sometimes you have to debulk a cancer and slow things down. But certainly you have to do some alternative things. There's just some things that you have to do. You have to change the environment that got you into the situation in the first place, or you're going to be in the same situation or worse, even after all the chemo and such. So don't make decisions based upon fear. You always have another opportunity. It's Mike, I can't tell you how many times where I have a patient that thinks that they have to choose between what my oncologist said and then doing something alternative. you can marry the two things. You can marry the two approaches and say, okay, well, I'm going to do chemo, but maybe I'm not going to do as much as he said I should do. And I'm going to do some other things as well to build up my immune system, even while I do that chemo. So important.
Mm-hmm.
That would be the biggest piece of advice. People don't think that they have a choice. Just to say, hey, this is your body. You can say, I don't want to do it that way. It's sometimes patients just lighten up like, oh my gosh, can I really say that? And the answer is, yes, this is your body. So you run the show, you be the captain of your ship. And that gives them power that has kind of been stripped from them in the medical profession. And you want to get that power back or you're going to be, that's not going to be real good results.
Yeah, beautiful advice. Love where that is going. And there's an acronym that I learned recently, and it's we have a website or a search engine that we all are familiar with, Yahoo. You always have other options. So I like that you said that you can blend the two together. There's no dogma where you have to do only chemo and you can't take any supplements, because, I get this question a lot, having worked in the nutrition industry, is that safe with chemo? It used to be that you don't want to take antioxidants and all that. I mean, I know there's probably caveats to, different types of cancer, where the cancer is located and so forth. But anyway, it's just really interesting that people kind of lose that power, like you just said, Dr. Connors. So,
right.
Real quick, anything on the antioxidants? It's been an update. I haven't looked at this research in a while, but for a long time it was no antioxidants, or that will impair chemo and or affect the cancer growth process. Thoughts there?
No, there's only a few different things that you want to be careful, and it depends on the type of chemo. So, and really, it's mainly fish oil. And it's mainly taking fish oil on a couple of days before the chemo and a couple of days after the chemo. And then you want to load up on it. Chemotherapy, most people don't realize, really does its work within the first 48 hours. After that, it's just killing good cells. So you want to pull it out of your body as fast as possible and do as much detox and get that out of your body as fast as possible. But that's the only caveat as far as nutritional advice with, where it could interfere with traditional oncology approach, and it's not with even every chemo.
Interesting. Okay, great tips. So this next question then is kind of about that, a dietary supplement, maybe a whole food, a nutrient, an herb, botanical. What's your favorite and why?
Probably my favorite would be one that we use, which is a medicinal mushroom blend. And we call it a medicinal mushroom blend, but we created it. And it has a bunch of other things in it. It has about 12 different things in it that I couldn't find in any one product out there. So we developed it. But it's in my book, with the cancer book, there's 10 steps that you want to make sure that you cover with your oncologist. And we can't get into them all now. And the blend that I created covers about 6 of those steps by itself, which is nice. It tests out really well on people, not on everybody, again. So this is such a unique practice in the way you have to really take care of people. You can't fit people into your protocol. You have to fit a protocol around the person. So I would say, if I had to pick one, maybe it would be that one. Maybe I'd pick vitamin D. Maybe, there's just too many possibilities there, I guess. So that's a tough question for me.
Yeah, no problem. I get it. It always is for a lot of people. So the final question there is, if you were to bump shoulders with Barack Obama or a future president in an elevator, or maybe, at some organization event or something like that, and you just had a few seconds, maybe 30, 60 seconds, to share with them one lifestyle or health tip you would want them to really embrace and share with other Americans, what would that health or lifestyle tip be, and why?
Well, if I was just trying to help that person's health, it might be to encourage him to be open to alternative care. If I was trying to encourage him from a political standpoint to influence a whole bunch of people, it would be to make alternative care be a part of the standard protocol and not be such this lunatic type approach where they're bashing anti-vaxxers and such, and just say everybody has a right to their own opinion, and it should be on the table at least as an option for care, and not something that is bashed by standard protocols because it doesn't fit into a money-making procedure for a pharmaceutical company.
Mm-hmm. Beautifully said. Awesome, Dr. Connors. Well, thank you so much for being on the show, and keep up the great work. I love what you're doing.
Well, thanks so much, Mike. I really appreciate all that you do.
My pleasure.